Did you know that the floor of your mouth holds key muscles that help you chew, swallow, speak, and even breathe better? And that if you're dealing with TMJ pain, those little muscles might be doing more work than they should. In today's video, we're diving into the suprahyoid muscles, their surprising connection to jaw tension, and how you can relieve and rebalance them with some simple research-based techniques. The suprahyoid muscles are a group of 4 small but mighty muscles that sit beneath your jaw and above the hyoid bone, which is a horseshoe-shaped bone in the throat. It doesn't connect to any other bones, it just floats around there. These muscles include the digastric, it has an anterior and posterior belly, the mylohyoid, geniohyoid, and stylohyoid. Their main actions are assisting in opening the jaw, especially when the mouth opens against resistance, elevating the hyoid bone and larynx during swallowing and speaking, supporting tongue movement, especially during the first phase of swallowing. These muscles work in tandem with the muscles of mastication, like the masseter and temporalis. But here's the thing. When your jaw isn't functioning well, whether due to clenching, grinding, poor posture, or even stress, your suprahyoid muscles often kick in to help stabilize things. Over time, they become overworked and tight, especially if other muscles aren't pulling their weight. This compensation can lead to pain, tension, and dysfunction, not only in the jaw, but also in the neck, throat, and even the tongue. If you've had braces, especially if elastics were used to pull the teeth and jaw into alignment, you may have developed hidden tension in the suprahyoid muscles that's never been addressed. Here's why it matters. Orthodontic treatment often focuses on aligning the teeth and jaw position, but it doesn't always consider how the surrounding soft tissues adapt to these changes. Elastics create constant tension in specific directions, and over time, the floor of the mouth muscles may become hypertonic. That means tight, shortened, and overactive. In fact, some people unconsciously change the way they swallow, speak, or rest their tongue to compensate for new dental positions or the sensation of braces and wires. This compensation can persist years after the braces are removed, and often goes overlooked in both dental and physical therapy settings. If you're someone who's had orthodontics and you're now struggling with TMJ pain, clicking, or neck and throat tension, this area is absolutely worth exploring. Prolonged mask wearing became a surprising contributor to floor mouth tension. During the pandemic, many people unknowingly began holding tension in their jaw and tongue while wearing masks. Pressing the tongue down or clenching the jaw slightly to keep the mask in place or to breathe more comfortably. This ongoing muscle activity can fatigue the suprahyoid muscles and exacerbate the TMJ symptoms. Be mindful of your jaw position under your mask. Try to keep your tongue in a relaxed position, tip resting on the roof of the mouth behind the front teeth, and avoid clenching. Let's talk what it feels like. Trigger points in these muscles can refer pain to surprising areas, including under the chin, along the bottom of the jaw to the mastoid, which is just below and behind the ear, into the throat, even radiating into the anterior neck or mimicking sinuses and tooth pain in the bottom front 4 teeth. It's no wonder that TMJ patients sometimes say, "It feels like it's coming from everywhere." So now you know what it feels like. How do we treat it? One effective stretch involves gently tilting your head back while keeping your mouth slightly open, then moving your tongue to the roof of the mouth. It is essential to hold your tongue to the hard palate. Hold this position for 20 seconds. If you feel any dizziness, return to a neutral position. Repeat 2 to 3 times, twice daily. Exercises like resisted jaw opening can help rebuild balance and control. Grasp your chin with your index and thumb in the center, or use 2 thumbs to gently resist the opening of the jaw. Open as far as you are comfortably able to go with no pain. Practice swallowing retraining is also useful, especially in patients with a forward head posture or history of neck injury. Exercising your tongue by pressing it firmly against the roof of your mouth will help with swallowing by strengthening the suprahyoid muscles and also increasing your tongue's dexterity, strength, and function. This is how you do it. With your mouth closed, teeth almost touching but not clenching, press your tongue up into the roof of your mouth as hard as you can for 10 seconds. Relax and rest for 10 seconds. Repeat the pressing and relaxing 5 times. This is one set. Do 2 sets a day. You can expect to see some results in about a month typically. Part 1 of the external massage starts with the hyoid attachments of the suprahyoid muscles. To palpate or feel for the hyoid bone, locate the Adam's apple or thyroid cartilage. Both men and women have an Adam's apple. Women's are just smaller. You'll feel a big bump followed by a slight notch right above it. The hyoid bone is right above that. Lightly place your thumb and index finger on top of the hyoid bone. Swallow. You will feel the hyoid bone move up and down under your fingers. Gently hold the hyoid bone with your thumb and stroke your index finger forwards, lightly pressing into the muscle 4 or 5 times. Now repeat on the other side by holding the hyoid with your index finger and use your thumb to stroke forwards. You could switch hands if you really wanted to. Now we'll look at the other aspects of the muscles. Use your fingertips to gently massage the area under your jawline along the submandibular area. Use slow, small circles or gentle gliding strokes. Beware of tenderness and work gradually. The lower jaw, mandible, only has bone on the outside of the mouth. The floor is all muscle. We want to wrap up underneath, staying close to the bone to treat it. Start at the tip of the chin with your thumb pointing straight backwards. Touch lightly and use the middle of your thumb pad to feel the edge of the mandibular bone. Lightly pull the skin forward a tiny amount. This creates some slack in the tissues. Now press slightly firmer up into the bone and roll your thumb to point upwards. Press into the bone and compress the soft tissue there, but never so much as to cause uncomfortable pain. We can gently rub our thumb back and forth the thumb width, about 4 or 5 times. Now let's go down the sides, doing one side at a time. Run your thumb up underneath the mandible, staying on the bone. Lightly press into the bone, compressing the muscles. Glide along like this towards the back, towards the angle of the mandible. Do 4 to 5 strokes. If you find a particular tender spot, you can stop and hold static pressure for about 10 to 12 seconds. You may feel a little tube-like structure. This is the belly of the digastric muscle. You may also feel midway along a squishy, tender area. These are the sublingual and submandibular glands. We don't need to treat those, so don't press and rub on it. If it's swollen or exceptionally tender, please consult your doctor. You may have stones or an infection in those glands. You can use a few drops of apricot kernel oil for lubrication to slide more easily. You don't need much. And if you're concerned about wrinkles on your face, massage a little into your face every night before bed. An 80-year-old woman taught me about this. This is an amazing skin trick, and you will see results in 2 to 3 weeks. If you're up for it, let's really get effective. With clean hands, or you can wear gloves if you prefer, you can gently press upwards behind the front teeth to contact the mylohyoid and geniohyoid muscles. This is delicate work, so go slow and be guided by your comfort. I teach manual therapists to perform this as part of the TMJ treatment sessions in my Simply TMJ courses. The link is in the description. Think of it like we are pinching the tissue between our fingers. But because I'm a professional, we call it compression. Press the inside and the outside fingers together and massage back and forth lightly, just moving a little bit. In the center, there will be more muscles and it will be a little thicker. As we go along the sides, it often is a little bit more painful when we get near the back. So be gentle with yourself. We are only doing a few minutes at a time maximum. It is better to do a few minutes daily than a big amount one time, once in a while. You can end up over-treating yourself and increasing your discomfort. So if you've been treating your TMJ without much relief, don't forget to look below the jaw. Literally, the floor of the mouth and the suprahyoid muscles are often the missing link. If you're a manual therapist, consider assessing this area more thoroughly. And if you're just trying to feel better at home, keep these tools in your self-care toolbox. If you found this helpful, hit the like button, subscribe, share it with someone who is struggling with jaw pain. Here's another video for you to consider.